Welcome everyone to a webinar on COVID-19 for fall semester. We welcome you and glad you're joining us today. A couple of logistical items as we get started. There is a live transcription or closed captioning available for this webinar. You can find it. To activate it, click the closed caption button, which is likely at the bottom of your screen on a computer. It could be in the upper right corner or the lower part of your screen on a tablet. You can share your questions and thoughts with us as we go along today. Please do that with the Q&A, which again should be in the control strip that you have at the bottom of your screen or somewhere on your screen for a tablet. And you can click on that Q&A box and type us a question, and we will be responding to those both via the Q&A app inside of Zoom, as well as some of the questions may be responded to out loud. We're going to also use a poll here. So please feel free to let us know what part of the Miami community that you are part of. We'll leave it up for a little 20, 30 seconds and then share the results with you and go on from there. So we'll close it out in about 5 seconds there. Thank you to everyone who responded, and I will share the results. And I'm going to turn things over to Dr. Jane Burnell. Thank you.
Hi, everybody. Thanks for joining us. I am glad we did that poll to know that we also have a bunch of faculty and staff on the call, as well as students and families. I'm Jane Brownell. I'm Vice President for Student Life. I am going to be doing most of the speaking today, but I am joined by 3 colleagues who have been right by my side from the very start of the pandemic. So Kendall Lesser is a faculty member and is our public health expert. Steve Large is our AVP for health and wellness here in Student Life, and Jessica Ravinius is our pro communicator, helping to write a lot of our weekly messages. So they're going to be behind the scenes helping me. So as you have questions, they know what I'm going to cover. So they will know what questions to feed me that I am not going to be covering otherwise, and may be able to answer some of your questions directly. So let me go ahead and share my screen. Now I have to find the right one again. I'm sorry. Okay. All right, Steve, could you give me a thumbs up if you could see the screen? All right, thank you. So here we are coming into another semester where honestly, we all were hoping not to be thinking about COVID anymore, but COVID is very much still with us. And so we are continuing to move forward. But the main thing to know about what we're doing is COVID keeps changing, so do our plans. We have gotten some feedback of why do you keep changing your plans? And it is because we are trying to respond to current environment, current situation, and our trend over time has been to be able to lessen our restrictions over time as much as we can. So we continue to work with our key partners, both in Butler County General Health District and at the state level, and then as well with Tri-Health and our health providers, as we work our way through with the expertise to be able to continue on and adapt our policies. But as we look at where we are right now, coming into the fall of 2022, we're in a very different condition than we were 2 years ago, 1 year ago, even 6 months ago. People have more of an ability to protect themselves. So they could get vaccinated, and we hope that you are. There are medications that are now available for those who do get COVID. There's a lot of natural immunity that has been developed over time as well. So as we are moving forward, we are really looking to shift more and more towards personal responsibility, that COVID is still here. People are still going to get COVID, but now there is more responsibility on the person themselves to protect themselves and to respond if they do get COVID in the end. So looking ahead, I'm just going to do an overview of all the major topics that are related to COVID. First is masks. Right now, I checked again right before the webinar started, Butler County, where Miami is located, is still classified as having a high level of community risk. We have had high levels of both positivity and spread all summer long. What changed a couple of weeks ago was the number of hospitalizations within Butler County itself. So we are at high risk. However, again, personal responsibility, we are encouraging you to follow the CDC recommendations that match what our community risk level is. It's red right now, it's high risk right now. That may not be true later, that will adjust. When the risk level does change, we will go ahead and notify the community that the risk level has changed, and then you make your decisions from there. But we will not have a mask mandate on campus. We encourage you to wear masks indoors, but there is not a mandate, with a few exceptions. So healthcare settings that they always are requiring masks, that is separate from Miami. We would expect that if you go into a place and that's true, that you would wear your mask in a healthcare setting. The other time that masks are required is if you do have COVID, if you test positive. We'll talk about isolation, but even when you get out of your isolation period, you are expected to wear a mask days 6 to 10 once you have tested positive to COVID. So those would be the exceptions. Now, I have also learned never to say never. That is where we are right now. We do not anticipate that changing. The only ways that I could see that we may need to change what we do with masks is, let's say that we had so many cases that we were at risk of not being able to keep our dining halls open because we have so many cases of people being ill that we couldn't be able to serve food. Or if a new variant came that was much more deadly than what we've seen before, we would need to adapt. We don't anticipate either one of those things happening. We intend to keep this as a recommendation, not a requirement. At the same time, there are also people who are more vulnerable, who have health issues, that masking is still going to be their choice for protection. And knowing that they're at higher risk, if someone on campus does ask you to wear a mask in their space, in their classroom, in their lab, in their office, in their residence hall room, we hope that as a community that you would be respectful of that and respect that they likely have a reason for why they want to take more precautions and wear that mask out of courtesy, not because it's mandated, but because we are a community and that's a courteous thing to do when someone asks you to do something in their space. So to do that, if you would carry a mask with you when you're on campus so that you can mask if someone asks you to, but we will not remove people from any environment. There isn't a penalty if someone requests and you do not wear a mask. Immunizations for all of our incoming students, because we have nearly all of our students living in residence halls, we have a whole list of vaccinations that students are expected to get. Measles, mumps, etc. COVID-19 is one of those of the list of vaccinations that students are expected to have when they come to campus. Students can request a medical or a non-medical exemption from any type of vaccination. And once you're exempted, you don't have to refile your paperwork each year. Your exemption is on file with us and we know that you have it. For new students, that immunization deadline to upload your records was August 1st. But of course, if you haven't done that yet, we want to have those immunization records, not just about COVID, but about all your vaccinations. So of course, we are still accepting submissions. If you have any questions about that, you can look at the Student Health Services website and you'll have more information there. For testing, we are also changing testing. We are no longer going to do surveillance testing. A couple of years ago, we were requiring surveillance testing, then we were offering it as a service. This year, we will not be doing any surveillance or asymptomatic testing on campus. The version of surveillance that we're doing, we are still continuing to do wastewater testing. So that is a form of surveillance that we're getting trends or looking for warning signs on campus through wastewater testing, but there won't be asymptomatic testing. If you are ill and you need a test, so if you have symptoms, you should make an appointment for symptomatic testing, either at Student Health Services or Employee Health Services, same building, 2 separate clinics. But that is a doctor's appointment. So that is you saying, I am sick and I need to see a doctor. The doctor will, or the clinician will ask you a series of questions to determine whether it makes sense for you to get a COVID test, and you would have testing. So there is no on-demand testing at Student Health Services. It is symptomatic testing with an appointment. So if you want to do regular testing, which honestly is just a good habit right now, we are all around a lot of different people in a lot of different groups. Routine testing should be one of those things that you are developing as a habit. Our suggestion is that new students coming to campus, continuing students returning to campus, order some free at-home tests before you arrive. All you need to do is go to this website. If you Google free tests from government, this site comes up. You could get 8 free tests. All you have to do is put in your address. There's nothing else that you have to submit, and they will ship you tests for free, including no shipping charges. So bringing a supply of tests to campus. Also, insurance companies will reimburse for tests each month. So some insurance companies, you may have to buy them and then be reimbursed for them. Others, you will cover it under insurance directly. But thinking about how will you have a supply of at-home tests? If you do need tests and you don't have any around, we will also have at-home antigen tests available on campus. They're available during regular business hours at Armstrong Student Center, King Library, and the Rec Center. But we cannot guarantee that we will always have a supply of those, that we will have them as long as our supplies last. So we are limiting those to 2 per person with a Miami ID as long as our supplies last. So you should take advantage of all of the free sites and don't rely 100% on what we could provide you here on campus. If you do an at-home test and you test positive, we would ask that you do complete a self-report to Miami so that we could keep track of what is happening on campus and where our numbers are. At-home tests, I also should say, antigen tests have become much more reliable over time. At the beginning of the pandemic, this was not something that we were recommending. I see a lot of chatter on social media and other things questioning at-home tests. Their false positives are actually quite rare. It is false negatives that you need to worry about. So if you take an at-home antigen test and your test is positive, believe it. If you take an at-home antigen test and your test is negative and you have symptoms, test again in a couple of days, because the reason you could get a false negative is it sometimes takes a while for the viral load to be detectable on an antigen test. But a positive test, you have COVID. So that is our information about testing. In the past, if you tested positive for COVID and you reported that test result, you would then participate in contact tracing. There is no longer any contact tracing happening by our local health department. But if they do see outbreaks in a particular place, they will investigate outbreaks. So we're not anticipating any contact tracing happening. If you are contacted for contact tracing because there was an outbreak, we ask that you still cooperate with that. But otherwise, if you test positive, it is your responsibility to notify anyone that you've been in close contact with that you're positive, so that they can take precautions and test as well. Isolation is the one area where we cannot lighten up. So everything I've said before, we have been loosening our approach. However, for isolation, we have a congregate living environment with residence halls, and we do have an obligation, both legal and ethical, to prevent the spread of disease on our campuses. So just like if you tested positive for measles or mumps, you would have to isolate. The same is still true for COVID. And so we have to follow those guidelines as long as they are in existence. If you are a student or you're an employee and you test positive for COVID-19, you have to isolate for at least 5 days. At the end of that 5 days, if your symptoms have improved and you don't have any fever for the past 24 hours without taking some kind of Advil or other fever suppressing medication, you can return to your normal activities on day 6, but you have to wear a mask at all times around other people for days 6 to 10. So if you remember, for those of you who were here last year, or actually the year before, it started a 14-day isolation. Then we went to a 10-day isolation unless you tested out. Now it is at least 5 days until your symptoms have improved, and then you can return to class or your residence hall on day 6, if that's the case, with a mask at all times. Now, if you need to isolate, you have a few options. Certainly, students can return to their permanent residence, they can stay with friends or at a hotel. That is true for on or off-campus students. But on-campus students, you cannot stay in your residence hall. That is an obligation that you have. If you test positive for COVID, you need to leave your residence hall room. As a service, you can request a temporary space on campus. We will have housing still available to assist students who need to isolate if they can't go home or isolate elsewhere. The way that you would do that is you would submit your positive test, you would self-report and say that you need a temporary room on campus. What our COVID case manager would then reach out to you and let you know where your residence hall room would be and help with arranging to have food delivered to that isolation space. That isolation space would be for days 1 through 5, assuming that your symptoms have improved and you have no fever. If your symptoms have not improved, you would stay until that was true, and that was the case. So we will still offer that as a service for students. If there is any change in those recommendations that we get or the requirements that we have from Butler County, we will certainly notify the campus that that has changed. Quarantine, I put quarantine and isolation because those two words always go together. But if you remember, quarantine is if you have exposure but are well. Isolation is if you are ill. So isolation, I, is for illness. So quarantine, there is no longer a requirement that you leave your residence hall to quarantine. But if you are a close contact, if you have been in contact with someone who has COVID, the first thing you should do is go to the CDC website, and they have all their rules for isolation and quarantine that will tell you what you should follow based on your vaccination status, how much contact you've had, and follow those rules. I am just going to check here 1 second. Okay. I see that there was a question about what happens if we are out of space. We do not, so there is always this, the isolation space is always on a space available basis. So yes, it is possible that we could say there is not a room on campus, and then it would be your responsibility to find a place where you could isolate. That has never happened. We have never had a condition, even at the height of COVID, where we ran out of isolation space. But if for some reason there was a major spike and that number of people wanted to stay on campus instead of leaving campus, there would be a chance that it would be your responsibility to find it. But that, I would be very, very surprised if that happened. We have not been in that situation yet. Okay. So thinking about the classroom experience in academics with COVID, too many years for too many illnesses, people would go to school and to work if they were ill. If there is anything that COVID changed, I hope that this has broken us all of that habit. If you become ill, stay home. That is the basic thing. Please don't go to class. Please don't go to your on-campus employment, and whether it is COVID or anything else, and spread the germs to other people. Notify your faculty member that you need to stay home and the dates and the duration of when you'll be home. And that faculty is going to be as flexible as possible. We continue to ask faculty to show flexibility for students who are ill. But students also need to understand that there are some activities and content that faculty may not be able to recreate, that there are some experiences, some labs that sometimes you will miss things because you are home. That has always been true, and that is true moving forward. But be proactive, knowing that you may get sick with COVID or with the flu. Last fall, we had a really bad flu fall. Be sure that you are knowing about office hours and how you could keep up with your material. Ask about what kind of additional work you could do or alternative assignments you could complete when you're absent, and start making those connections with other students in the class at the beginning so that you could support each other and keep each other up to date. Now, faculty are people too, and also get sick. So know that if an instructor is ill, or if the instructor determines that there are a large number of people who are going to be out at the same time, they can switch from an in-person to a virtual modality for that class for a week while they're ill. So this is not a, we are flipping from in-person to virtual for the semester. This is not a permanent arrangement. This is a faculty member. The same way that I would notify my supervisor when I'm ill, a faculty member will let their department know that they are ill or a lot of their classes, and that they'll need to go to virtual for that week. But if there is anything that would last more than a week, that would require approval beyond the department level. The provost would look at those, and those would be rare. So students and families could be confident that the modality that a class is offered in at the start of the semester, whether that is in-person, virtual, or hybrid, that will stay what that is for the entire semester. And then the last piece is life on campus. We are doing our very best and will continue to do our best to give students as normal of a college of experience as possible. As our policies have changed, so has our approach to being on campus. We've also seen, though, that students have changed. So there is more and more interest from students in a mix of wanting some virtual options, of wanting some hybrid options, and students who want to be together in person. So we have shifted the kinds of programs that we do in our approach so that we are offering opportunities to students no matter their comfort level or no matter their style, and making sure that they are meeting each other and building community and finding connections, because those things are so important and part of what makes Miami, Miami. So we're going to continue to do that. I am going to pause there before that is the COVID content. I am actually going to say a few words about monkeypox. But before I do that, I want to check with my support team. Is there anything else that I have missed or anything else that's come in?
One thing that came in, if you can just revisit, is if they're required to show a negative COVID test when arriving to campus next week.
Okay, sure. No, we are not doing arrival testing this semester. So for those of you who are returning students, you might remember that one semester, everybody had to go to Millette and drive through and be tested. Then last spring semester, you had to bring proof of a negative test. We're not doing any of those things this time. We ask that before you come to campus, you do a symptom assessment. You and everyone else in your moving party should look and say, are we all well? Are we all healthy? And if you're not, please don't come back that day, or don't have someone help you move in that day if they have symptoms. Figure out an alternative, reach out to us, tell us you need to come back later. But personal responsibility, we are going to trust that you are not going to come back to campus if you're ill. We're not going to require that you show us proof of a negative test. Not a bad idea to take an antigen test before you leave, but we're not going to collect that information. Anything else I've missed? Kendall, Steve, Jessica?
No, Jane, there's been a lot of questions coming through, but you've either answered them as you've gone along, or we've been able to answer them in chat. So thank you.
Great. All right. Well, then I am just going to say a few words about monkeypox, although I keep saying, I can't believe we're talking about another illness that has emerged. So monkeypox, all I am really going to say on this is we are aware, we are paying attention, we are meeting on this. We've already been talking to the Department of Health. We're collecting information from the American College Health Association. We've already had planning meetings, and we will have an initial communication out to campus in the next week or two, just with some education about what monkeypox is, how it is spread, how to protect yourself. But there is likely more to come. But at this point, I just want to reassure everybody that this is on our radar screen and we are on top of it, taking care of planning and educational messaging. So I'm going to stop sharing my screen, and we can give one more minute to see if there's anything else that we've missed. But I think we were able to cover everything in a half hour, which is pretty good.
Hey, Jane, just a question. Can you go back to the isolation slides and review kind of the process? I think there are some questions about that. So for instance, if the student is required to isolate, will they have assistance moving their things back and forth? How will they know where they're going? Just can you guide us through that again?
I will. So I'm going to take this from the point of view of a student, and I will talk primarily as a residential student. If you test positive, either at student health or at the urgent care or at home, the first thing you should do is fill out a self-report form on our website. On that website, you are telling us that you have tested positive for COVID, and our assumption is that you are then going to isolate, that you're going to leave campus either for home or with a friend, unless you are a residential student and you click the box that says, I need a temporary room on campus. If you do that, depending on what time of day, you will hear from someone within the next couple of hours, or it could be overnight, depending on what time. Until you hear from them, you should be wearing a mask and keeping your distance from other people as much as possible. Then someone from Miami will reach out to you with a room number and a building of where you need to go. Since this is now a 5-day isolation from either your first day of symptoms or from, if you were asymptomatic, from the day of your test, that means that you're not needing to bring 14 days worth of stuff with you anymore. You're bringing probably 2 or 3 days worth of stuff with you. We are not currently offering transportation, but this is located in Wells Hall. It's very central. It is not a long walk from anywhere. When you're there, the note that you get from our COVID case manager, along with information about where you will be able to isolate, you'll have information about how to order meals, and meals will be delivered to your room, and you'll get instructions about that. You'll have choices each day. You'll also get a check-in from someone from Student Health Services. You'll get at least a phone call, perhaps a visit, depending on your needs, to make sure that you're doing okay and that you have everything you need. You'll also have a packet of material of who to call if you do need assistance with someone, who the COVID case manager is, so that they can check in with you as needed. But again, hopefully this will be an easier stint than it was before, because it is a shorter duration of time, but you would be able to keep that room for as long as you needed to. If you are off campus, you would isolate for your 5 days, and just like anybody else in the community, you would be responsible for getting your own meals and medical care. It would only be that if you were in a room on campus that you would have that follow-up, but you would certainly still have information about who to reach out to on campus if you do need assistance. The other thing that doing a self-report would trigger is that you can let us know if you want us to reach out to your faculty to let them know that you are ill. We would not tell them that it was because of COVID. We would just tell them that you were ill and wouldn't be in class, and we could help you negotiate that communication with your faculty. Jessica, do you think I hit all of the questions on this?
That and more. Thank you so much, Jane.
When you ask me to go into more detail,
You did.
I can get
I
into a
love it
lot.
just from the student approach and how they would have it and experience it. Thank you so much.
We have also updated our COVID-19 website for this semester, so that information on our policies and our practices and what to expect, the resources that are on there are current.
Jane, just a couple more questions.
Mhm.
How are we handling the request for temporary rooms for isolation? And then what is provided in the rooms when they are isolating there? Do they need to bring their own bedding? Do they need to bring their own water? Things like that.
You know, Steve, I may actually test your memory on this a bit more. I'm hoping that you could help with this. We recommend, if there are things that will bring you comfort, to bring them along. But Steve, do you remember what was in the room?
Absolutely. So there is water, there is bedding, and I believe with Wells, the temperature has been reasonable. I think in years past, maybe a couple of years ago, there was some concern about the rooms being a little chilly. So a student may want to bring their own extra blanket if they'd like. There is a microwave, there is a television. So it's certainly not home, but it's also fairly accommodating though as well.
Thank you. Jessica, did I miss a piece of that?
Just how are requests handled? Like if you have a student from California that needs a room, a student from Cincinnati, you know, what metrics go into deciding who gets the room?
It's really about first come, first serve with space. What we have found in the past, I think at our peak, we have had, I'm looking at Steve since he's on screen, we've had maybe 50 people in isolation at one time, but we more typically have fewer than 10 in isolation at one time. So if that was at the peak of the pandemic, we are anticipating and hoping that we would not come close to filling an entire building with at Wells. And honestly, more students prefer to go home. The reason that we had so few students even at the peak was if students can go home, that is typically what they do. but we have never had a time that we've had to turn a student away, an on-campus student who needed an accommodation.
Thanks, Jane. We're getting some, lots of questions are coming through, and we're responding to them individually, but there's some themes coming up as well that if it's okay if I can run them by you.
Sure.
One theme is around monkeypox and wanting a little bit more information about the plans, particularly around the length of isolation that's required and what that could mean for a student's academics.
It's a little early to get into the details of this. We are in a planning process, but this is brand new. We met yesterday and there are about 8 people who are off doing homework assignments right now. So we'll have much more information on monkeypox within the next week or two. The biggest concern that I think we'll all have with this is, while COVID is a 5-day isolation, monkeypox is a 1-month isolation. And that month, they are required to have their own bathroom. That is not the way that our residence halls are set up. We do not have private bathrooms. There are very, very few rooms available that would have a private bathroom, and a month is a long time. So we are still talking about what that means, but I think it is much more likely that a student who has monkeypox would need to return home to be able to isolate for that length of time. But as I said, we are early days. We have a thorough planning document. We've identified all the issues. We have our assignments to go off and find answers, and we will have more answers in the next week or two.
Thank you, Jane. There's another couple of folks have brought up their preference to be able to ask students to leave the classroom, or to require mask in the classroom, but if nothing else, to at least be able to ask students to leave the classroom. The more specific question, though, is what if students are exhibiting illness, if they're coughing or if they're ill, and they still don't leave if you ask? Is there any recourse that the faculty has?
I would say that then the faculty should follow the rules that they do with any other type of behavior, that they would go up the chain to their department chair, to their dean, to their provost for support. But we will not remove a student from a classroom if they do not wear a mask. That you can certainly ask a student who is ill to try to keep some distance from other people. You can request that you could request that if you are teaching and have a tighter space, that you can ask that people with masks are in the first rows that are closer to you. But also be aware, and this is something that I did have in my notes and I didn't say, if you are concerned about your health, no matter who you are, like what role you play at the university, if you wear a KN95 mask or an N95 mask, you are very well protected as an individual. That as the research on masks continued, you are more protected as an individual wearing a KN95 mask than if everyone in the room had on a cloth mask. So if you are a faculty member, we do have those available to you through your department or through the provost's office. If your department doesn't have one, we're happy to supply you with KN or N95 masks. And that is good personal protection, but we do not have a mandate, so can't remove students from a classroom for not wearing one.
Jane, another question around, thank you. Another question around the relationship that Miami has with the other 13 state public universities in Ohio, and whether the decisions of those universities impact ours at all. The specific example was used that OU reinstated their indoor mask mandate, and whether we considered that when we went to non-required for our mask mandate.
Sure. So the fun fact is Steve Large is the chair of the conversation. We work very, very closely with, it's called the Inter-University Council. IUC is the network of all of the public institutions in Ohio. And We have regular meetings every week or two, depending on what the topic is. But there is, because we have developed relationships over time, we're in more informal communication. We have a good network when we do have a question. What happens is we compare notes. We ask to learn from each other. We ask what their approach might be. We get ideas, but different communities are different. That our campus, which is in Oxford, very residential, very rural, is going to have different needs than an institution like Akron, which is mainly a commuter campus and has more non-traditional students. So we do not operate in lockstep with each other. We learn from each other, we compare notes, but in the end, the decisions that we're making are the decisions we're making as Miami. In relation to masks, we did consider it. We had the conversation, and after talking to our partners in the health district, as well as with TriHealth, we made the decision that we were comfortable moving to personal responsibility when we know that nowhere else around campus in their other lives are they in the habit of wearing masks anymore. None of us are that much in the habit. And we made the decision that we were going towards personal responsibility.
Thank you so much, Jane.
Any remaining questions?
There's one that I was responding to right now, but I'll just go ahead and put it in the room. And then at that point, I think this is our last question. We responded to 33 other ones. So this question is around SDS, Student Disability Services and Accommodations. And that one accommodation is being able to sit closer to the front. There was concern though, that if students with masks were asked to sit in the front, that would out anyone who potentially had an accommodation. My thought on that was going to be that might be best resolved between the student and their accessibility coordinator to think through that. But I don't know if you have any other thoughts, Jean.
Yeah, I agree that would be a conversation both with the faculty member and with Student Disability Services. It is not a secret from faculty that would be the accommodation. That would be part of the letter that would go to them. That if that is an accommodation, the faculty would be aware of that. That wouldn't need to be announced to the class as a whole, but that would seem easy enough to manage between the student and the faculty. And if not, the student could certainly talk to the Miller Center about how to navigate that.
Thanks, Jane. Wondering if there's still currently no open questions.
Great. Well, thank you for joining us today. This is recorded, so this will go up on the COVID website and we'll let people know when it's there, but you could look for that soon. And here's to a smooth and exciting fall semester. Thanks.
Thanks, Jane.